Data for Decisions opens enormous possibilities for the generation of knowledge to improve healthcare practices, services and health outcomes. Our data privacy, security and governance measures are second to none. Keep watching to learn more about Data for Decisions and look at our website.
The research program is called Data for Decisions.
Yep.
Can you tell us what data we're talking about and what sort of decisions we're actually looking into?
What is a bit of a gap in Australia right now is having good primary care data, and we're talking about in particular routinely collected data that is collected during consultations.
A really key part of this is that we do have data and we do have decisions.
Mm-hmm.
So this is certainly not a case of just taking lots and lots of data from general practice and us publishing studies about epidemiology. In fact, what we want to do is take that data and then think, okay, how can we feed this back to develop interventions or tools that then can help GPs and patients make decisions together about how we can optimise their health.
What would a GP have to actually do? What does it look like for them?
In terms of any work for the GP, the system just sits there in the background, and once a week information contributes into the Data for Decisions repository.
The thing that gets me in with this sort of stuff is we can't just sit down and ignore the quality of this data and just leave it on our servers at our office. We need to actually bring it out and find a use for it.
When you ask people about being involved in any sort of research gathering, they always say, well, if it helps. And they like to be reassured that they're part of something that's going to, even if it doesn't benefit them immediately, that it will input into some good for the community.
Once this information has left our practice, it's escaped and we don't know where it's going. And so we're trusting you to be looking after it and in ethical ways.
If the governance committee thinks that this is the right sort of project, then external parties would have to sign an agreement that goes over and above the law in terms of the steps we ask them to take and the things they can't do with that data. The aim here is for complete transparency, so our website will have information of every project. We want this to be something that works for practices, that's for sure.